welcome back to another episode of the Crime Scene Insiders. I'm one of your hosts, Angela Davies, and I'm joined by my co-host, Dion Watson, and we're going to take you back under the barry tape.
Today we are very excited because we are joined by Dr Judy Hinchliffe, and Judy is an absolutely amazing woman with an incredible career in forensic odontology, and we're over the moon that she's given up her time to come on the show to chat with us today. We actually met Judy and had the privilege of working with her back in 2019 when we were all deployed to an international air disaster in Ethiopia. By a means of introduction, Judy is a forensic odontologist with over 30 years of experience working across the UK, New Zealand and Australia. Judy originally trained in dentistry, gaining a Bachelor of Dental Surgery from Sheffield University here in the UK, before going on to specialise in forensic odontology with a postgraduate qualification in the field. She's been recognised across both hemispheres, becoming an honorary fellow of the Faculty of Forensic and Legal Medicine in London, and also a fellow of the Faculty of Oral and Maxillofacial Pathology with the Royal College of Pathologists of Australasia. Judy is also a past president of the British Association for Forensic Odontology, and notably, she's its first female and youngest president. Judy's work has taken her all over the world, including involvement in major international incidents such as the 2004 Indian Ocean tsunami and the 2005 Sharm el-Sheikh bombings, as well as numerous criminal investigations and murder inquiries. So today we're going to explore what forensic odontology really involves, from day-to-day casework through to its critical role in disaster victim identification. So welcome to the show, Judy.
Yeah, hello, you two, and anybody that's listening.
To get us started, for anyone who's listening who hasn't come across it before, what is forensic odontology and what does a forensic odontologist do?
Well, I guess you could say that forensic odontology is almost like a marriage of the dental system and the legal system. And mostly we get involved with identification of human remains. That be the single body or, say, a car incident or the mass disaster situation. We also do bite mark analysis, so that's drifting off a little bit because that's become a little more controversial. Age estimations. So, I mean, particularly useful for us is age estimation at time of death, so that we can help narrow the field and then, give an age estimation that this person is so young or old, and it might distinguish one family member perhaps for another.
It's absolutely fascinating. It's a really interesting area, I think, and we will come on to the bite mark analysis stuff a little bit later because it has been a bit controversial recently, hasn't it? Mm-hmm. So it'd be really great to get your take on it. But originally, you were a general dental practitioner first. How did you actually move over into forensic odontology? Interested you in it?
Can I tell you a little silly story?
Please do.
Of course.
I was about 5 or 6, and my pet tortoise died. Right? So this is the first death that I've ever been around. And so we had the full ceremony and buried it in the garden. And then a month or 2 later, I decided I was going to do some gardening, which my parents were very impressed about. So I got my little trowel. Fortunately, a parent was watching, and I started to dig where we'd buried Billy. And when my dad kind of said, whoa, now then, what's happening here? We don't want to disturb him, do we? And I sort of said, well, I want to see what he looks like. And I think Billy would like me to have his shell. So I don't know. I think a lot of forensic people have got that curious mind, and they like puzzles, and they're intrigued with what's going on. So maybe that was the start of it. But really, I guess it happened because I've always been interested in the pathology and I suppose the forensic world in general. And I used to go to some very, very good lectures at Sheffield University from our Home Office pathologist at the time, which was Alan Usher. And not only was he a very interesting pathologist, he was a very good speaker. And I think he kind of lured me in. And I thought, oh, I could be doing the wrong topic here. Maybe I should be a forensic pathologist. But it was a bit late because I was already well into the dental career. So it was sometime later. I've been in practice for a while and doing some teaching at the Sheffield Dental School. And a colleague of mine actually said, this is right up your street. He'd seen an advert in the British Dental Journal that there was a course running. So I inquired about it, but they only took 12 people on this course per year. So they suggested that I joined the British Association of Forensic Odontologists, BAFO, to just see if I liked the flavour, see if I found it interesting, and it was something I could do. So I joined the association, and then the following year enrolled for qualification, and that was the beginning, really, of 30 plus years.
30 plus years as a forensic odontologist. You must have seen a heck of a lot in that time. We know from meeting you in Ethiopia and from chatting, and then we have been doing some digging on you before this podcast. As you can imagine, you know what we're like.
Sounds a bit creepy, doesn't it?
Not in a creepy way, but your career is just so incredible. Can you remember the first piece of forensic casework that you actually did? I know it's going back 30 years, Judy, but
yeah. I haven't lost my memory just yet. One of the first major ones, which was a high-profile case, was a headless body. So you think, okay, where are the teeth in this? But a very sharp forensic pathologist, of course, sent the stomach contents of this body, which had been stripped of clothing, very badly burned. So whoever was committing this homicide did not want this person identifying, and they taking the head off. And they sent the stomach contents to the lab, and there were some little portions came back, and they said query teeth. So that's when I was called to this one. They weren't actually natural tooth fragments, but they were very small parts of a porcelain crown. So we knew that our victim probably had a porcelain crown. It's perhaps unlikely that he might have eaten part of the crown belonging to the perpetrator. So I did a report on this, and I remember walking to the car park and saying to the superintendent, I think we'll ever find their head. And he went, oh, probably at the bottom of a canal somewhere. This was December. 6 weeks later, the head turned up in a school playing field, you know, the man walking the dog. And he recognized that it should not have been there and had the common sense to call the police. And one of the police said, hasn't there been a body found up Manchester way? And so this was a different jurisdiction, but the coroners got together and they DNA'd and said, yep, this is the head that belongs to this body. Can we take it any further? So I worked on that one. We got no idea who it was. So I was just literally doing a post-mortem examination, putting the fragments back together, doing the dental charting, x-raying, taking photographs, and then sat back to wait and see if they got anyone to compare it with for the ante-mortem or before death records. And then the police got very excited and said, oh, we think it's this person. And he's actually from France. We're really liking this. What do you think? And uncannily, they had one x-ray from the French person. And it was one of the quadrants in dentistry where there was a bridge unit. So some crown work replacing a missing tooth. But it wasn't quite the right naming of the teeth. The tooth that was missing was wrong. Right. And so I could say, yes, it's definitely a bridge unit, and I can see why you're excited, but it's not the right bridge unit. We're a tooth out of step. And the police sort of said, oh, okay. The following morning, because they were back on the phone saying, are you sure? Because we're really liking this one. And so I was thinking, oh my goodness, you know, if I get this wrong, this is my career blown before I've even taken on. So I went back to the x-rays and rang them back and said, I'm absolutely certain this is not the same person. And sure enough, several weeks later, we did get a tip-off. There was a facial reconstruction done that went on Crime Watch. A lot of names came in, and one of them married up with the dental charting of our victim. So I think the lesson there is have the courage of your convictions if the evidence supports you. If everything is lined up, have the courage of your convictions, even if you're starting out. And the other little thing from this one was that there was a very, very nice forensic pathologist that I met on this case, and I've been married to him now for 30 years. So it's not all doom and gloom. There you go.
I don't know how weird that sounds, though.
I know.
Things happened in the mortuary.
We met in the mortuary. It's a bit dark, isn't it? Now? But hey,
it's a great story,
things come
though.
out of it. And we got the identification. We got the identification of our murder victim, and the police, once they got a name, that helps them. If they don't know who the deceased is, it's very, very difficult for them to even start looking at any part of the case. They just don't know who could possibly be involved.
I think it is a great lesson, that, Judy, and a great story as well, because we always say evidence doesn't lie. And at your age, as a new, fresh odontologist, being put under pressure, like, are you sure we'd like this person for it? Being put under that pressure to actually stand by your evidence and say, no, this is what it's telling me, it is amazing. Like you say, a great lesson for anyone new coming through in particular.
And it's like in your crime scene, you fanatically document everything, you record it. And for us, we will examine the body, we will do a dental charting, we'll do the radiographs, we'll do maybe CT scans if you're lucky enough nowadays. And then it is the documentation and, of course, continuity of any evidence if you're signing any samples off to anybody. And then your contemporaneous notes, they've got to stand the rigors of investigation. And, let's remember, at the end of it, you may well be asked to do a report or a statement which may go to court. So you have to be able to stand by your evidence and make sure that everything is lined up and that you're very happy with what you've got in front of you.
Yeah, completely agree. Can we take you back one step? And again, for our listeners, could you maybe explain how an odontologist does an identification?
Usually we're called by the police or the coroner, and often there is an idea of who the body might be. So let's say we've got a burned out car and a body within, then the police will obviously look at whose car it is, and could it be the driver, could it be a joyrider? So they may already have a tentative name. So whilst I'm on my way to the mortuary to examine the post-mortem remains, they will be looking for the ante-mortem dental record. So they may ask relatives and then check with the dentist if they know who they've been seeing. The dental record will then be supplied to the mortuary for us. The police will collect it for us. I tend not to look at the ante-mortem record until I've done my post-mortem examination, so that I'm not biased with anything. So I can then write down all my findings, do photographs of the teeth, x-rays, and make notes at the time. And remember, we've got a potential to have 32 teeth. And each tooth has 5 sides, a front, a back, a top. Not to mention, we've got all the hidden dentistry, which is the root system in the jawbone. So we can pick up an awful lot of information from that to be comparing with our ante-mortem record. And of course, the ante-mortem record includes any x-rays the dentist has taken, any dental models that have been taken for, say, crown and bridge work or dentures or orthodontic purposes, and all their notes or referrals, and somebody being sent out for wisdom teeth extraction, which means perhaps an oral surgeon at a local hospital may have further records and x-rays. If they've had orthodontic treatment, tooth straightening, then there'll be models from before and after treatment and lots of good x-rays for us to look at and detail from those models. So we've got a lot going, providing we've got an available and accurate record to compare it with.
So it's a very detailed job looking at a lot of information.
Yeah, I mean, we're only dealing with the mouth. Think about the poor forensic pathologists who are dealing with the whole body. But it's like you guys, you're used to crime scene work, and everything has to be meticulous and documented so that you can keep coming back to it if you need to. Often than not, the dental identifications don't go to court because they're agreed. And then that brings you on to how do you work like this. Back in the day, I started doing a lot of these on my own. Then when I hit New Zealand, we had a look at standards and decided that we would have 2 dentists working the case. So we worked in pairs. And that's brilliant because you've got 4 eyes, you've got 2 brains here, you can bounce ideas around. It does instant kind of peer review, and you also learn a lot together. So working in pairs, I think, is the ideal.
And you've got that check in place, haven't you? Must give you a little bit of reassurance knowing that there's a second pair of eyes over it.
Well, because you can't afford to get it wrong. Because a positive identification means that that body can be released to families. And at the end of the day, that's what it's all about, is getting that body transferred from a post-mortem number to an ante-mortem name, so that body can go back to the families, and at least they've then, it's the end of hope for them, but at least they have certainty as to what's happened.
Yeah, that is, like, just from the work that we've done as well, that is a really rewarding feeling, isn't it, when you get an identification and you can return them home. But it's quite a lot of responsibility, that, isn't it? How do you kind of carry that weight? How do you deal with it as you're doing the work?
Well, just by being meticulous and detailed and
Yeah.
cross-referencing with a colleague where necessary, and just making sure that everything, stands up to criticism, really. So to make sure that you've got all your support evidence well documented, and so that you feel happy that you've got a positive identification or even an exclusion, because that can be quite handy. And then that can go to the powers that be for a final decision. The coroner might decide they want something else. But bear in mind that the three key identifiers that stand alone are fingerprints, DNA, and dentistry.
Yes. And what is it that makes teeth so useful from a forensic point of view?
Well, I think the number of combinations that you can have in any given mouth, plus they're very resilient to general wear. They even survive quite well in some fires, protected by the orofacial tissues. So the enamel that covers the tooth, the bit that you can see when you look in your mouth, the crown part, is even harder than bone. So it's very, very resilient. And of course, if we're lucky, we've got the antemortem dental record. A lot of people have dental records that we can compare it to. But of course, there are some instances, as I'm finding in Australia, where some of our Aboriginal community do not go to the dentist or don't have good records. And if you recall, the same in Ethiopia, or when we're out in the Comoros Islands doing disasters, it depends on where the victims come from. If they're not from a country that is good on dental records and people getting dental treatment, then you're a bit compromised.
So what do you do in those instances if there isn't any previous records to do your comparison with?
Well, that's a tricky one. But sometimes we'll still record all the detail in case a dental record comes up at any point. Or more recently, we've had things with social media, smiling photographs, where at least we can sort of say, aha, well, they had front teeth because they're there on the photograph. And maybe if the teeth are a little bit crooked, we could do superimpositions and take a look at that. Or, of course, our colleagues doing facial reconstructions. We'd even look to see, are the teeth beautifully straight? Is there perhaps an orthodontist involved? And we could track his records. But it makes it a little harder, that's for sure. But again, if you say got a car accident and 5 people are killed and 4 of them have got dental records, then you can exclude that 5th person, if you see what I mean. We can identify 4, and if we know who the 5th one could have been, the power of exclusion can be also quite strong.
It's absolutely fascinating.
It just reminds us, actually, when you said about the picture, we had a guest on, Julie, who I believe you've also worked with, and she was involved with a murder investigation where they solved it from a photograph that had the skull and the teeth, and they had a photograph, and they actually got the identification through that, actually.
Going back to our headless body, with that, I said I was lucky enough to work with Richard Neve, who did the facial reconstruction. And that went on the television, and we got the names coming in. And he himself said, well, I can only be this accurate. There are some little things, even with facial reconstruction, that is partly artistic. I mean, that's moved on now, and with all their kind of algorithms and computer programs, it's a lot better. But, it was just finding that person, getting a name suggested, and taking it any which way we could. From doing the dental charting to, we put it in dental magazines, and the facial reconstruction that went with it, and eventually we got a bunch of names, and we could narrow it down, get their dental records, and come up with the right one. I spoke to the dentist who'd been treating him on the phone, and originally he read out the dental charting back to me on the phone, and it was one of those moments that after 3 months of waiting for an identity, my hair started to stand on end, because I thought, this is the one. And that is, as you say, very satisfying, and then enables the police to take it further.
I was going to say, what was interesting there is that now you're saying from some social media photographs, you can start work from there and look at images of the teeth. Has that been one of the changes over the year? Now there's much more access to photographs on the internet.
Sure. And we used smiling photographs in the Christchurch earthquake to try and help us narrow the field. But I also remember back as far as 2005 with the Sharm el-Sheikh bombings, we were looking at photographs developed from perhaps cameras then, but or internet, anything we could get our hands on to show smiling photographs, and we got some really good ones which really helped us with an identification. But yeah, I think we're now trending towards social media and artificial intelligence, dare I say, as to where we're going with that.
Do you have any idea where that could take forensic odontology?
I'll wait and see on that. I mean, the thing is now it's becoming more commonplace, more popular, and with that comes, I think, an increased responsibility and risk, and the challenges that go with it. So I'm sure it's going to do a lot of good. I can see us having instant access to antemortem and postmortem comparisons, say in a disaster, instead of, we've got computer systems that do this, but I think now, with something like artificial intelligence, it'd just be so much faster, more efficient.
So you have worked on multiple criminal cases, murder investigations, but then you've also worked on a significant number of major international disasters. How did you progress from working on criminal cases and single deaths to then working on disasters?
I think it was timing, really. One of my mentors always said to me, one day I will make sure you're on a disaster with me. And then, of course, up popped the tsunami. Meanwhile, I'd done a small one, and there's little things to learn from everything. I'd been out about 2000 on a fishing boat that had gone down, and they were trying to actually bring the boat up and identify the deceased. And that was a very emotional one, really, because a lot of the fishermen were related and from a small community. And I remember worrying all the way over on flight, thinking that I think there were 7 victims. What if we only get 6 back and 1 is left? That really bothered me.
Yeah.
And in fact, we were very lucky that we got all 7. And I think the lesson there is you can't become too emotionally involved. I mean, you can't help it. Say the Sharm el-Sheikh bombings, we were only sent out there as a British team to locate the British victims, of which there were 10 and 11 died later. And that became quite personal because on the wall of the mortuaries, I had the dental chartings of all these people. And after a few days, you almost know them off by heart. So as soon as we found remains, and I was thinking, there's the gold crown. It's narrowing the field. This could be such and such a person. But you can't afford to get too emotionally involved. You've got to be able to put it somewhere safe in your head. And I think, chatting with colleagues, debriefing is very important. So that not just from a point of view of the disaster as to what worked well, what we need to tweak, what didn't work so well, what can we do, but also looking after the mental health issues of your colleagues. So you see somebody flagging a bit, or if they're not happy, it is teamwork after all. And it doesn't matter whether you're a fingerprint person, a DNA person, somebody from, the funeral service, we're all the police, we're all working together with the same aim, and you look out for each other. And I think that's very important because it has been said that the discomfort can be accumulative. I'm lucky that I know I can do this work, but I'm married to a forensic pathologist. So we can talk about instances in the mortuary together without freaking anybody out. So I think it's very important to look after your health. And the bigger the disaster, I think going out to the tsunami with my mentor was almost beyond belief. Again, I remember sitting on the plane and thinking, goodness me, the numbers are going up and up and up of fatalities. And the sheer scale of that, I think, was very difficult to handle. It was almost surreal. Each day there were bigger numbers of bodies being found. And I remember thinking, Lordy, how are we going to deal with this? But you do. And I was fortunate with the tsunami that I got 4 deployments out there. So I got to see every phase of quite a lot of the disaster, the way it was running, but also the dentistry, starting with inputting the antemortem information coming in from the dentists around the world, and the post-mortem findings from our colleagues in the mortuary, because we have to standardize things so that we can, compare apples with apples. And then working in the mortuary myself, and then doing the reconciliation or matching and the quality assurance, and also being the manager of the teams towards the end. So I learned a huge amount from those trips, which put me in very good stead for things that came later, like the Sharm el-Sheikh bombings, Morris Island plane crash, of course the bushfires in Australia. I was living in New Zealand at the time, and of course the Christchurch earthquake, and then of course meeting you guys in Ethiopia.
That is such a massive disaster to start on. Of course, you had, like you said, you had the small one with the fishermen, which is kind of a nice introduction. But then from that to such a scale on the tsunami, I'm not surprised you were thinking, how are we going to do that? I'd have been bricking it on the plane, I think.
Yeah.
Yeah, I mean, it was daunting. But, the interesting thing is when you're doing, say, a single body or a few bodies in the mortuary, you do the whole thing. So, you get the records, you get the post-mortem records, you've done the post-mortem, you do the comparison. There, it's such a big scale, but you're doing one section of it. So you might be doing inputting your records, you might be doing the post-mortems, but you don't do the comparisons. So it's kind of like you want to carry on and do it all through so that you know who's been identified. You want to see it through on a personal level, but on those sort of scales, you can't. You have to do your bit and then send it in, and everybody else is doing their bit, and then a different team is going to do the matching. So it's kind of, I want to know who the woman is who had this gold work, but I will probably never know that unless I'm doing the reconciliation work. So it's just a huge learning curve, and you can take that forward, because we all know that the disasters, they're all different. You might be dealing with fiery deaths, floods, bombings, all sorts of acts of terrorism, acts of war, and natural disasters. So you apply it. No two are the same, and it's just a big learning curve. What works well, what didn't work so well. And as I said before, looking after your teams, you really need to keep the mental health of all the team going and keep your eye on people, because people can quietly come unstuck.
Yeah. And that's one of the things, isn't it, about working on disasters, is the teamwork and the camaraderie. And also people are not very egotistical about their roles. Well, not everyone, anyway. Most people are not egotistical about their roles. So you just jump in where you can, doesn't it? Whether it's making everybody a cuppa, or cleaning up and sweeping the mortuary floor, or doing your dentistry work, or working on the fingerprint section, or working sometimes on personal effects. Like, you do what you can for the best outcome. I've found anyway.
I think so. I think the people that go on these are of a mindset, most of them, where you're out there to do the best you can. You're going to work together. You're going to support your colleagues. We've done things like helping strip bits of muslin rolls, to wrap little fragments in. I've done labeling for people. If there's a lull in the dentistry, I'm happy. I don't mind what I do. Within my experience, I can't take over the radiology or the DNA, but again, you can learn a lot from what your colleagues are doing. And you muck in and hope that at the end of the day it's going to work, and that person is going to be sent back home identified.
Yeah, that's exactly it. And it is a rewarding feeling when you get towards the end and you start wrapping up. So you've worked across all types of disasters, as you were saying there. So from tsunami, from watery disasters, to bombings, to earthquakes, to air disasters. What is some of the impact of that on your work? And are the challenges different between the types of disaster?
Yes, I would say they are. I mean, if you've got a complete body and a complete jaw and set of teeth, then you've got maximum information from the dental side of it. But often, let's say in a plane crash, you may have fragmented remains. So that's much, much harder. Fiery remains, as I said before, teeth do survive fires quite well, but they're very fragile. So you have to be very careful with burnt teeth, and you may have to fix them first. And then you can carry on very gently with your x-rays. And it's also important that people who are at the scene understand the nature that, and perhaps bag the heads or the fingers, so that you're not losing vital information for the fingerprint people, or, teeth being lost because perhaps the body's decomposed and the teeth are beginning to be lost. So you need to keep all the remains that you can. But yeah, they're very, very different. And it's always disappointing if there are not a lot of dental records for that trip. For instance, in Ethiopia, we did all the dentistry, capturing the information from the post-mortem bits we got, but the dentistry didn't prove to be too useful, as a lot of people on the flight had got no dental record.
Yeah.
But also, I remember holding a little fragment in my hand and thinking, it was clearly a small person, child, and we did an age estimation of it. And so I knew at that point there was only one child of that age on that flight. And I just thought, this is identified. I know who this little person is. And you just think, Lordy, they got on this flight with their parents, not realizing that this flight would not land. And then it gives you a nasty jolt, and it brings it home to you. But, you have to be very careful with this. You have to be robust enough, I think, to be able to deal with this work so that it doesn't affect your ability to do the job.
Yeah. Do you have any rituals then, or ways that you decompress from these deployments? Because sometimes you can go out for months, can't you? And then when you come home, like Dee and I, we found it sometimes difficult, didn't we, to kind of fit back into reality? Mainly probably, I think, because we expected people to have our tea ready for us at the hotel, and it didn't happen. We had to start doing our own laundry and cooking, yeah.
Yeah, I think you need a bit of time to process it.
Yeah.
And what was lovely on one particular disaster was they said, right, Jude, your work is finished, but we can't fly you out tomorrow or the day after. There isn't a flight. So we're going to hire a minibus, and a few of you are going to go to the ruin site that you really wanted to see. And that was great, because it meant work was done. We went off to the ruins, which put a distance between it all, had a lovely day as though we were tourists, and then flew home. I think I'm very good these days at putting it safely in my brain, because I'm distraught if there's like a cat that's been run over in the road. But I know I can deal with this. It's a bit of a conundrum, that, but I know I can put it somewhere safe in my mind and process it until you can't. So that's what you've got to watch out for, I think. And that's why I think the mental health care is so important.
Yeah. We often say, discussing with colleagues who are kind of in the same boat as you, they understand what it's like to be submerged into that work. That really helps, doesn't it?
It does, but you can't guarantee that everybody is going to cope with it when they get there.
No.
I think, we've had some surprises where we thought everybody was fine and dandy, only to find that one colleague, was perhaps struggling. And as long as we can pick that up, then, the team organisers can send them back home and make sure they've got any appropriate counselling and they're looked after.
Yeah, I think it's really important as well for people to be conscious and aware of their own mental health, isn't it? Because it is important to look out for your teammates, but you're so busy in these situations that sometimes it's just so fast paced and your head's down and it's work, work, work. And you do look out for people struggling, but it's not always easy to pick up on because people mask really well as well. And I think sometimes people don't want it to be seen maybe as a weakness, or that they're letting anybody down or failing anybody, and really want to succeed in the work, but it's just too much. And they mask so well that it's sometimes tricky. So I think being conscious of your own mental health and people speaking up is a really important thing in these arenas, because I think if you let it go too long, it can be really, really damaging.
Definitely.
Yeah. Because, one instance that comes to mind is that in the tsunami, we've been standing up in a very hot mortuary most of the afternoon, and each body had a police officer, if you like, checking, that everything was going well and the numbers all matched up. And he just suddenly said to me, "Are you feeling all right?" Because he'd gone awfully white. And I suddenly actually thought, yeah, I actually just feel a bit faint. I said, sure, I'm going to sit down. And within minutes, he brought me one of these pick-me-up drinks. And 5-10 minutes later, I was back to normal again. But it was just, I think, the heat and the standing up for hour upon hour. And he spotted it very quickly. And then he said, are you going to knock off now? And I said, no, I'm fine again now. I can carry on. But I was very impressed that he spotted it. And
Yeah.
Yeah, that's really
that
good.
is true. You do have to look after people, and you just don't know what their limits are going to be.
I think one of the other things with that is often in these disasters as well, you're working with people that you don't ordinarily work with or you don't know personally very well. So for something for them might be really different in their personality. So if somebody knew them well, they might be to say, oh, that person's really not themselves at the moment. I can see something's affecting them. For us, when you don't know them as well, it can be difficult to realise actually when somebody's out of character, can't it?
Yeah, you're right. You're right. I mean, usually we work within our own little teams, say the UK team, or the French work in the French team. But you're right, you don't always know these people well enough to assess them very well.
This might be a tricky question because I know your career's spanned a few decades and you've worked on so many disasters and also then on criminal cases as well. But I'm just wondering, across your career, is there any one in particular that's stuck out for you or stayed with you for any particular reason?
Yeah, I mean, think of a lot of cases that do impact, perhaps, a little more than others. There was a little case of an age estimation where I was simply brought a lower jaw, a mandible, by the police. And they said, can you just age this for us? They gave me no more information. So I did an age estimation. In fact, I did several different types, the more the merrier, to get the best result. And they're called age estimations for a reason. You're not necessarily going to be able to give a very accurate one. You'll always, a couple of standard deviations and all to allow for variety and variance. But it was clearly a child jaw. And by the time I got my results, I gave them an age range of, say, 7.5 years to 9, because it's a bit easier to actually do age estimations on children when they've got a mixed dentition. That's the permanent teeth and the baby teeth. Lots of things developing, and we have data sets for that. And the police sort of said, brilliant, because our missing child is within that age range. Now, the actual age range, it come up at 8 years and 3 months. I thought, if I told them that, they'd have thought I was a complete genius. But in fact, we got the estimate, but we could do what we could with the dental identification. And I think that went on to mitochondrial DNA as well to prove who it was. One of the strange things about this was that I was leaving the dental school, having done the x-rays and had the little mandible in a little bucket container. And as I walked out to my car, it was parked on an urban clearway. And I'd obviously overstayed my welcome a little bit. And there was a policeman there on his motorbike, about to give me a ticket. And then he spotted me, and I said, and he spotted the white coat over my shoulder and said, oh, you've been working at the hospital. I said, yeah, I'm sorry, this has run a bit late. And then he looked at me, and he looked at the little container, and he said, I suppose you're going to tell me you got a head in there. I thought, well, true words were never spoken, so I just smiled benignly and we carried on, and I didn't get a ticket. And so my little jawbone went home, and we got a successful identification from that, which was very good. And it was actually a Manchester case, which was quite high profile at the time.
Fantastic. You just can't make some of these things up, can you? Coming out of the hospital and having a jaw in your back and being pulled over by the police.
No, I know, it's very strange.
Have a lot of those kind of things happened to you over the years?
Yeah, only in forensics.
Yeah. One of the things that we did touch on earlier was bite mark analysis. And that is something that forensic odontologists do. You work in bite mark analysis. Is that something that you've done throughout your career? And have you made any comparisons and identifications based on bite marks?
Yes and no. Yes, I've done quite a fair few bite marks in the past, but I've always thought that they're not really strong enough to give a definite identification. Because if we're talking bite marks in skin, skin is not a very good impression material. So you get distortions or lacerations. So it's hard to interpret. Just occasionally, you may get a really, really good mark. And if I can see what I might find in the biter from that bite mark, then we might be able to take it a little bit further and at least say we can't exclude this person. Now, because there's been a lot of controversy around bite marks, the general status is that you cannot give this person did it. And I don't think most of us have done that. But occasionally it's gone wrong. Particularly, I'm thinking of the Kennedy Brewer case in the United States back in 1993, I think that was. So a little girl went missing who was the non-biological daughter of Kennedy Brewer. And although he was in a relationship with mum and had children with her, this little girl went missing and was found deceased in a little creek nearby with alleged bite marks. So the pathologist and the dentist said, yep, bite marks. And they worked the case up and said, I think the conclusion was beyond, without doubt, these marks were caused by him. And it was only some years later, when the Innocence Project got involved, that they had the marks re-examined. And because the body had been in a creek, it turned out these marks were actually made by aquatic creatures, not by bite.
Wow.
Meanwhile, back in the day, the DNA was not strong enough to do anything much with. But as techniques got smarter and more sensitive, they then said, we can exclude him. But the powers that be still wanted to hold him, thinking, well, even if he didn't murder her, he might have been involved in some way. And it took years for the Innocence Project to work through this and say the DNA, in actual fact, by then belonged to somebody else, and they could prove that the technique was so good. And so he'd been in prison for a long time for something he did not do. And so bite marks got a very black mark from people perhaps overstepping their expertise. And I think if you've got a bite mark where you have limited people with access to that bitten person, it can be very useful to say the dog did not do it. This is a human bite.
Yeah.
Which takes it down a different pathway for the police. And also to be able to say, well, if there are only 4 people with access to this victim, then maybe we can exclude them, or maybe we can include one and just say this one can't be excluded. And remember, with bite marks, you have DNA from saliva, if you're lucky. So, that may be a more powerful tool. But they still have their uses.
Yeah, so I was going to say, from your experience and expertise, they still have their uses, but not maybe in context of this person definitely made this bite and there's an identification and putting somebody in prison on the basis of.
Absolutely not. Yeah, we really don't want that. It's just perhaps an indicator or an exclusion, and that's as far as we'd want to take it. Or to say, this has been caused by a dog, a rat, or whatever, if it's going to help the inquiry.
Yeah, it's good to know, and it's good to hear from you because, like you said, there has been so much controversy around it. And I think a lot of people have even gone to the point of calling it a pseudoscience and saying that it should be completely eradicated from forensics altogether. So it is nice to hear from your expertise, actually, there are some uses. It's just if it's used mindfully and appropriately.
Yeah, I think, people with sort of appropriate experience and the cautions to put it to good use. But, it has been dubbed junk science because it's not something that's provable. It's very subjective. And people don't agree. There was the American Academy of Forensic Sciences, the dental association associated with them, the American Board of Forensic Odontology, actually sent bite marks out to colleagues and said comment, and they didn't agree. So, you can't have something like that where people do not agree there's a valid topic. So you do have to be very careful. You have to treat it with the limitations that it has. And, of course, DNA is pretty useful if you can get it from the, the skin. But I'm very cautious and haven't done any for quite a long time. And I would never state this person's absolutely the one person who's done it. It's just not good enough for that at the moment.
Thank you for that perspective. You're currently semi-retired. Are you still working on disasters? Or have you given them up altogether? Or would you still go in a heartbeat?
It's very difficult to give up, isn't it? I'm semi-retired and I do quite a bit of lecturing. But I won't never say never, basically. Even with Ethiopia, 4 or 5, 6 years ago, I wondered if I got physical and mental stamina to do the job justice. And it was only when I got there that I thought, I can do this. And it was very rewarding to know that some of my younger colleagues were actually quite tired. I thought, this is okay. I'm still in the council of this. And it is hard to give up because there's something about doing a disaster, the camaraderie, the working together. You know, you meet international colleagues from around the world, and a lot of those have become friends. So I worry about the day coming where you sit at home on your laptop and they send you all the dentistry to do, and you don't actually get to go out. Because to me, that's really important, to network with people, to find out how they work. I've learned a lot about fingerprints and DNA. I'm no expert, but I've learned a lot more, which helps you understand what your colleagues are trying to do. And the day that we sit at home and just sort of do it in a sanitized fashion on the laptop, I think will be a bit disappointing.
Yeah, I can't imagine that for you, Judy, at all.
No, I mean, we wouldn't be here chatting now if we hadn't met at a disaster. You know?
Well, exactly. Yeah. You're Australia based now as well, so it'd have been even less likely that we would have met.
Yeah, I mean, I've been very fortunate to live and work in 3 different countries, because you learn a lot about the different cultures, the approach to death. You know, we learned about the Maoris in New Zealand and the Aboriginals here in Australia. Got to work with colleagues around the world, and yeah, it's been very satisfying. And I've been very fortunate to have that scope of work.
And have you found different approaches to disaster victim identification in different countries across all the disasters that you've worked in?
Not so much, because I think people are now, you know, taking a lot of notice of Interpol and the standard operating procedures, shall we say, and the protocols involved. You know, for us, the dental teams, we have the forms that are all the same, and it doesn't matter whether you come from Finland, you know, Thailand, Germany, Canada. We all work to the same language, if you like. We've got standardized dental techniques, standardized symbols, so that we all know what we're dealing with, and we're doing it in the same language, so we can all understand each other, because, you know, charting systems differ around the world, so we're all using the same format. But there are instances where, you know, we have a lack of dental records, which makes it very difficult for us. And I think you need to assess each disaster and work out what's going to work well, whether it's going to be the fingerprint people or the DNA people, or in some cases, the dentistry works really well. You know, when we left the tsunami back in the end of 2005, the dentistry had done a huge amount of identifications there. And I'm sure over the years, the DNA has crept up. And I think a third of the victims from the Christchurch earthquake were done by dental methods. And the thing with dentistry is, as long as you've got the record, it's quick. It's sort of like, yes, it is, no, it isn't. So, you know, that worked well. And there's a competitive edge, which is great, because you're all determined to get the identification right. You know, the fingerprint people were saying, we might have got a match with this. And we'd be saying, this is a possible for us too. Or yes, it's a definite, or no, it's an exclusion. So working together like that, I think cements the teams, and it's a very important thing.
The Victorian bushfires that you worked on as well, wasn't it? That dental was really important in that. And again, it's going back to what you were saying at the beginning, it's the absolute resilience of the teeth, which you don't always get necessarily from fingerprints and DNA. So it can be so important in some of these disasters.
Yeah, I mean, this was the 2009 Australian bushfires, because of course we have a lot of them. And the complexity of that was that these were in rural areas. So it was more of an open disaster as opposed to a closed one, where you've got an idea of, say, in an airplane, you know the passengers, you know the crew. There, people were moving around from one house to their neighbours, and the cat and the dog were there. So we had commingled remains and very badly burned remains. But I think the dentistry still, about a third of the victims were identified through dentistry with that too.
Amazing.
What happens when you get that call, Judy, for one of these disasters? What goes through your mind?
Well, it used to be a bit of a mad panic, because I've been working at the dental surgery as well. And it'd be, you get the call and you know they're going to say, we're going to fly you out tomorrow at the latest. So you've got to be really prepared. I mean, I had a little kind of go-to bag with a little bit of my kit in it and a few old T-shirts and clothes I didn't mind, you know, leaving behind. But I had the most amazing dental nurse at the time. And so if I was going anywhere, she would whiz into the dental practice and cancel all my patients, because it's pretty annoying for them to cancel. But I have to say, they were a really good bunch of patients. When they realized what I was up to and the work I did, you know, they grumble a bit about being cancelled, but they understood why. And then I used to have a day off, and I'd try and shift everybody around so that they didn't have to wait too long. And then I think the next thing in your mind is, crikey, what are we going to find when we get there? But you're going out usually with a team member or a couple of team members, so you've got a good network to start with, and then you just fit into the occasion, learn from your colleagues as to what's been going on, and pick up the process. It's nice if you're replacing team members to have an overlap, so that they can tell you what's going on, show you the notes they've made, and you can pick up the baton, as it were, and carry on. But that doesn't always happen.
Yeah, it's back to that briefing and debriefing, isn't it? Which is really important.
Yeah, I think a briefing before you start, a debriefing at the end, and to make sure that people know what you can do. We had a hot air balloon crash in New Zealand when I was there, and I think the police at the site did not know what the odontologist could do, and I was dispatched to the site because we wanted to find any fragments of teeth and to give the mortuary a heads up as to what sort of state the bodies were in and whether dental would work, which it certainly would. And they didn't understand why I wanted to bag the heads and make notes and everything, because it slowed everybody down. But, getting it right is what counts, to make sure my colleagues back at the mortuary got the best possible chance with the dental evidence. So we worked together, we explained what we did, and, eventually we all learned together. It's a good idea to know what your colleagues can and can't do.
Definitely. Have you found that quite often, probably maybe not in disasters, but when you're working with police, that they don't have a clear understanding of what your role is?
Yes, certainly to begin with, because for me, this isn't something you do every day. So you tend to work with different police forces, and then they train people up, and then they disappear, and then you've got a new batch. So you're never quite sure what they know that you might be able to do. So it's usually just handy to have a quick chat first and say, this is what we're planning, this is the state of the remains, this is what we can do, and it'll take me so long, and to make sure that they've got any possible antemortem records already there so that we can get along. Because as soon as you've got a death announced, there are relatives on the end of this who are waiting and worrying. And we had a story where a local coroner decided he would just cut out the middleman and go straight to the practitioner whose patient it was that was deceased. And of course, they're not trained in this. They're not accustomed to what burnt bodies might look like and decomposition, nor are they accustomed to doing legal forensic reports. So the dentist went down there and then said, oh my goodness, this is not my thing, and disappeared. Took the records with him. This was Friday, so I got a very sheepish call from the coroner on the Monday to say, do you think you could come in and do this? My error, and now we've got the records back from the dentist, so can you come in and do it? So he said,
and one traumatized dentist as well.
Exactly. So it's very important that you get the right person to do the job with the right experience and the right training. So anybody being interested in this sort of work, I think, I would say to them, join your local association, if there is one, to see whether it's the sort of thing that you would be interested in. And then, of course, get yourself a postgraduate qualification so that you understand it more deeply, and then get a mentor where possible. And come and join the British Association for Forensic Odontology and, get to know a few people, and that'll help you network and decide whether you want to do a qualification in it. Because you're probably not going to get far without a qualification in the UK.
And it's such a specialist as well. Of course, you've got to be a dentist first to be able to go on to forensic odontology. Just because you are a dentist doesn't necessarily mean you can be a forensic odontologist, because you do have to be a certain kind of person, because at this level you're encountering a lot of death, and the role changed quite significantly, doesn't it, in terms of what you're seeing and what you're enduring and what's expected from you.
Well, that's right. Your basic dental degree and your dental work in the field of practice or hospital doesn't really prepare you for this. It doesn't give you necessarily the legal training that you need. So you need to be able to understand the system to make sure that you can go and do the best job for that, that victim. And it's not everybody's cup of tea. And I think you have to decide whether you can do it or not. And those of us who know we can or think we can are probably the ones that will go for it. It's a fascinating subject. It's given me an amazingly interesting working life. and I wouldn't have given any of that up.
We know that you're really well published. You've written in a lot of journals. You've also got a lot of chapters in books. You do a lot of lecturing on this subject. But do we have a Judy Hinchliffe autobiography?
I've got a first page of something, and I get asked this a lot after lectures, oh, do you have a book that we can check? And all I can say is, no, go back to textbooks and things. I haven't done an autobiography. I'm a little worried with that because you've got aspects of copyright and consent, which we need to consider. So maybe I'll just write a homicide novel one day. I don't know.
Oh, that'd be
But
brilliant.
You've got to let us know.
I will.
Well, and that's why it's so important for us to do things like this and have you on the podcast to be able to share some of your experiences. So thank you so much for coming on and, like we say, taking the time out. And also, we know the time difference for you is mega.
Yeah.
Today, it's wine o'clock for you.
Just keeping from my dinner.
Keeping you from your dinner, and it is wine o'clock, where for us it's cup of tea o'clock.
It's been an absolute pleasure, and thank you very much for inviting me. And I hope that anybody out there watching just finds this topic as fascinating as I do.
I'm sure they will. Dee and I find it absolutely fascinating. It's why we wanted to have you on. And also, we also wanted to have you on after working with you in Ethiopia, because it was an absolute pleasure to work with you and spend time with you. And we miss you a lot. So next time you're in the UK, we'd like to have that glass of wine and a good old catch up.
That's a definite. Yeah, later this year, it's a definite. We'll definitely have a catch up. We're due a good one.
Definitely. Well, we look forward to that. But thank you so much again.
Thank you so much, Judy. We've really appreciated it. We're sure that our listeners will find that fascinating as well. And thank you to all of our listeners for tuning in for another episode. Please remember, if you're enjoying what you're hearing, hit that like button, hit the subscribe, follow us on whatever medium it is that you're tuning in today. We'd really appreciate that. And we will be back in a fortnight's time, where we'll take you back under the barrier tape.